Hey guys, it's Dr. Josh, and today in this episode, we're going to talk about broken ribs, pop ribs, how to tell the differences, and some of the things that you should look out for when it comes to jiu-jitsu injuries, right? So if you're watching this, you probably hurt your rib, you probably felt a pop, usually in this type of area, and it could have been done from an explosion, explosion movement, it could have been done from like you locking down a triangle, really kind of cinching down, it could have been done from a body triangle, or maybe somebody drove their elbow or head or a knee on belly on into the ribs. And despite rib injuries being very, very rare in terms of like what you look up on Google, and even in the research and literature, they're actually pretty common when it comes to jiu-jitsu and some contact sports, right? So even though it's really rare to find or find in the literature, it's actually quite common in our sport. So kind of what you want to really watch for, and when it comes to pop ribs, like now it's really hard to diagnose what the injury truly is, right? Because you can have a cracked or popped rib, or broken rib I should say, versus a popped rib. And typically popped ribs occur right here in the front, so if you can kind of see that right here, they're typically within the 7th, 8th, 9th, and 10th ribs, right at the costochondral junction. So that's pretty much right where the bone comes here and starts to meet right around where those cartilage or the hyaline cartilage actually attaches to. And so you can actually get a fracture of that cartilage, believe it or not. And the reason it's actually pretty soft and pliable is so that the rib cage can expand and contract, and it can actually take some impact in that, because if it was so darn rigid, right, it would just pop anyway because it would be so rigid, right? So the reason there's a little bit of give in that area is so that it can actually absorb those forces. Unfortunately, sometimes in jiu-jitsu, it is a contact sport, we end up getting so much of that force into that rib cage and we feel a pop. And that could be actually a fracture of the cartilage, right? To be honest, it's actually very likely that you probably had a mild fracture. There could be a slipped rib syndrome where literally the ribs kind of slip out. Sometimes you may need to get that surgically repaired. Sometimes it actually will dislocate or relocate. But what you really want to watch for is, after giving some time off, deep breaths, movement, bending, twisting, turning. If you feel like it's constantly slipping out and it's not getting improvement with rest, with other types of modalities that I necessarily can't explain according to your doctor, right? That might be including but not limited to medication advice. That's up to your doctor. But if it's not getting reduced or not going away and there's constant slippage in there, there's a chance that you might have even dislocated or fractured it, and it's not like kind of repairing and kind of going back up, because it's kind of like staying in this type of position, right? So that's kind of one of the differences there. When we talk about cracked rib, we can also say a broken rib. Most cracked or broken ribs typically occur at the angle here in that area. And so it's not likely in jiu-jitsu that you get that, but maybe somebody picks you up, suplexes you on the side, maybe you kind of land right here and maybe you crack a rib. That's an option as well, but sometimes that impact here can be dispersed upon that area. So when it comes to jiu-jitsu, in my opinion, I mostly see the cartilage disruption, and that could be a separation, it could be a mild fracture, it could be major, but you have to realize that in terms of chiropractic, in terms of soft tissue healing, I'm not going to go in, whether it's a fracture or even a chondral disruption, I'm not going to go in there and kind of adjust somebody very aggressively. We're going to have to do some other modalities like soft tissue treatment and really treat the patient, like yourself, if you're watching this, a little bit more therapeutically and a little bit less aggressively. So really, one of the big things you really want to look out for, as I said before, is that constant slippage. There's no improvement with, according to your doctor, according to their prescription of medication and rest. You want to make sure that that's not happening. You want to make sure there's no bruising, no bleeding. One of the big red flags on this type of thing is that if you have two ribs that kind of separate, now you have like a sharp, essentially, bone that's sticking out, and it could hit into the lung, and we can have some internal bleeding and things like that. One of the ways that people look at x-ray or look at these types of rib injuries is through x-ray. However, x-rays don't always show the cartilage, so the gold standard for this stuff is MRI and CT scanning. And so it's very unlikely that many of you out there are going to go ahead and get that, but I think having a good understanding of what's actually happening to your rib cage will help you understand, what's happening, where to go from here, how to rehab it properly. I always err a little bit on the side of caution, and maybe don't adjust people or tell them to rest a little bit and make sure that the cartilage and the rib cage is lining up. Again, in my career, even though I've been training for 10 years and treating for over 10 years now as well, I have never seen I've seen a rib fracture once as a result of jiu-jitsu, because most people actually don't go and get the MRIs and the CT scans because it's just very costly or time. But that is the gold standard if you actually really want to find out what's going on. In my opinion, it's probably a little bit better that you rest. Maybe you kind of do some other activities and stuff like that. Maybe take a little bit time off of high impact in jiu-jitsu. I discussed some of this options in another video, but the major difference is that one's a fracture of the actual bone and one's more of a fracture or a disruption to the cartilage. You typically see sometimes an indentation in that area, or you'll start to see and or feel some fibrotic type of materials kind of happen as a result of that disruption when the soft tissue starts to actually re-heal. You do want to watch out for difficulty breathing, things like that. You really want to make sure that people are, including yourself, breathing properly and that there's no pieces, so to speak, poking out, because those can present a large hazard in that. So if you feel like you're constantly having a slippage, it's constantly not stabilizing, and it doesn't get better with small amounts of rest or even minor and major movements that actually hurt, and it kind of slips all the time, it might be a good idea that you go get this checked out. So hopefully this provided you a little bit of value about what is there when it comes to rib injuries, cartilage injuries, and rib fractures and things like that. But it's a very unique spot because, again, the research is not necessarily there, but it's very common in our sport. And it's not like it's a shoulder or an elbow where you can kind of just brace it like this, right? The rib cage, you kind of just have to keep it very still and steady. So hopefully this gives you some more insight, guys. Thanks again for watching. And if you're watching this video, I hope you heal up soon. And please reach out if you have any questions. Have a great day, and thanks again for watching.